And I need you to stop what you're doing and come to the TV to hear this story. Did you know most gynecologic cancers are diagnosed in women over the age of 60? Yeah, this was news to me too, but take a look at the numbers. According to the CDC, ovarian, uterine, and vaginal cancers are most often striking women between the ages of 50 and 70 years old. The cancers are likely in the late stages by the time they're diagnosed, and that's because many women do not know that they should still be seeking care and pelvic exams even after menopause, and their doctors don't always advise them to do that either. This morning, I'm introducing you to one woman who is turning the loss of her Nana into a life-saving mission.
She was definitely a rock.
Solid rock.
A solid rock.
It's been 12 years since this mother and daughter lost the rock of their family.
Marlise Yvonne McIntosh Henderson. Every time I invoke her name, she lives.
Mrs. Henderson, already a breast cancer survivor, was diagnosed with uterine cancer at the age of 87. She died 2 weeks later.
Mom was everything. She was my lifeline. Caused me to cry. I'm sorry.
Mr. Henderson died days after his wife. Their daughter and granddaughter grappled with unspeakable grief.
I have an irreparable damage in my heart. That's where my grandmother was. And I don't want anybody to feel that.
Vanessa Hill channeled that hurt into research about gynecologic cancers. According to the Centers for Disease Control, the average age of diagnosis is often between 50 and 70. One of the warning signs for these types of cancers, bleeding after menopause.
You have to tell me if you see blood, because you should never see blood.
Dr. Keisha Burfoot is an obstetrician gynecologist in Norfolk. She says it's very important for women to keep seeing their gynecologist and having pelvic exams even after menopause. And it's up to doctors to let them know the warning signs too.
Once you go through menopause, you should never see blood again.
Mrs. Henderson did see blood about a year before her diagnosis, but she hid it from her family and doctors. By the time the pain became unbearable, the cancer was at stage 4.
I wanted to take the place of what my mom was going through. My mother reminded me that that was her journey, and I couldn't take it.
And for her granddaughter, grief gave way to a nagging feeling that she could have convinced her Nana to get help before it was too late.
She didn't have to die. And in my thought, if I knew, I could have convinced her.
Now Hill is on a mission to convince other Nanas with Project Nana. She created the organization to educate and empower seasoned women about their health, especially the prevalence of gynecologic cancers after menopause.
It was a shock. It was a revelation.
Irene Hardy, Laverne Huggins, and Mary Henderson all participate in Nana Chats.
We're in a safe place, and we can talk about things in this group that we can't share otherwise.
In these sessions, women their age learn, laugh, and live.
You're in a different phase of your life, but you're still living.
Vanessa looks on with pride, her mission to push prevention making an impact. Words of wisdom that helped her make her own life-changing decision last year.
It was a hard decision that I made.
Doctors found precancerous cells throughout Hill's reproductive organs. They advised her to have a hysterectomy so Nana's fate wouldn't become hers.
What was that decision like for you?
It was the hardest thing because anybody who knows me knows I want a house full of kids. I was in fertility treatments.
Her doctors say her decision to get ahead of any cancer saved her life, a life she's dedicated to honoring her Nana by helping to save yours.
I have a lot of life to live. I have a mission that I need to continue to put on my back. Every single thing I'm doing is literally because of Nana.
And so brave in sharing her story too. You know, Vanessa Hill says there's another hill to climb, getting Medicare and private insurance to do a better job of covering more frequent gynecologic visits for women over 65. Some of the women in her group had trouble getting appointments if they haven't been seen by a gynecologist in a while. While Hill's research, very important here, it's been on the disparity about older women getting that care. It's recently been published in a medical journal.
you know, a lot of families may be watching this morning, Jessica, not really knowing that this is a necessity. So how often should women be getting these exams?
Yeah, this is something that is news to a lot of women who've gone through menopause. Dr. Burfoot, who you heard from in the story, she says it depends on a person's overall cancer risk, but she recommends at least every 2 years. In the meantime, you can learn more about how to advocate for yourself from Project Nana. We have a link inside this story up right now at WTKR.com.